Hey guys, it's Dr. Sexton talking today about fatigue again and how you can maybe use supplements or actually not use supplements in order to boost your energy level and take care of the problems that might be causing your fatigue today. So I see a lot of patients that come and talk to me about fatigue and they'll tell me, oh, my friend told me that I should take this supplement, or my chiropractor or my massage therapist told me about this herb that I should be taking to improve my energy. And I want to know what you think about it. And my approach to that question is to essentially say, look, if it makes you feel better, feel free and do it. But for most of these things, it hasn't been proven to happen. And the only thing that this is going to accomplish is draining your wallet of a little bit of something. And so you may want to be a little bit careful when you are trying to figure out what supplements to use or not use with regard to this. But my goal is usually to simply make sure that they are not taking something that might interact with their medication or cause some kind of complication. Once we've done that, then I explain to them, look, the reason that these supplements do what they do is some of them are based on the idea of they've got a little bit of stimulant in them. So whenever you use something that has caffeine or cacao, those things might make your heart race a little bit more, give you a sensation that you've got a burst of adrenaline. And that can make you feel like you're going a little bit better. And with a simple bit of momentum, you're going to accomplish a little bit more throughout the day. That's more of the benefit of normal human psychology as it is to the chemical that you actually took. The chemical stopped working probably about 30 minutes after you had the supplement. So really not that impressive whenever you look at it. Other things that patients will ask me about after they've talked to me about their ginseng or whatever supplements that they've recommended. B12 they'll ask me about. Shouldn't I get B12? Well, if you're a vegetarian, you should always be supplementing B12. Getting a sublingual B12 vitamin would be sufficient. If you've had a gastric bypass surgery, you can't absorb that nutrient very well, so you should be trying to get a supplement for that. But other than that, for most people with the American diet and American lifestyle, you don't actually need to supplement B12, and it really won't make you feel much better beyond placebo. So keep that in mind whenever you're looking at these kinds of things. And we could have discussions about why it is or is not that you don't need those kinds of things. Wouldn't it be better to get more of a good thing? If these chemicals are involved in energy, isn't this something that I would want more of to get that kind of energy? But the fact of the matter is, no, that these chemical processes go through a chain of events, and because there is a bottleneck at one of those events, by building up your building blocks out here with more ginseng or more caffeine or anything like that, you don't actually make it so that the process happens more rapidly, and it's not necessarily going to give you all of that energy. So don't think about giving yourself too many supplements at the front end in there, because you're just throwing the money away and not necessarily giving yourself the energy level. Now, whenever it comes to things like nutrition and what you can do as far as how you eat, those things really can influence how your energy levels are. Understand that whenever we are taking in nutrition, when you eat the foods, certain foods break down in your stomach and in your bloodstream a little bit more rapidly than others. Simple sugars obviously don't need to break down further into sugars to get into your bloodstream and become sugar inside your bloodstream. So they're going to be the most rapid to be digested. But whenever you take long-chain carbohydrates, things like bread and wheat, they're going to be broken down into their simple sugars and get into the bloodstream very rapidly. Whenever you're eating simple carbohydrates and breads and pastas and those kinds of things. And the effect of that is that they're going to get in and raise your blood sugar up high relatively quickly and then be utilized by your body a little bit more rapidly. Your body senses this up and down of sugar and makes you then feel tired, like, I had energy, where did it go? Oh, I guess it's not here now. Other things, other foods that you might choose to eat instead of just carbohydrates, eating a little bit more protein. That takes a little bit longer to be digested in your stomach. And so because it gives this more continuous stream of energy to you, that might be a better way to give yourself nourishment during these days if you've been having fatigue, so that you don't have that quick and rapid up and rapid down of energy that you've got going on. Now, last in the line of molecules that get digested in your stomach are fats. And true, while that would give you a nice slow trickle of nutrition into your body throughout the day, the problem is that whenever we take on fats, they usually sit in your stomach for a while. It takes so long to be digested, and so much blood needs to go to your stomach to digest and absorb that fat that's in there, that blood is not left for your brain in order to use for thinking and all of the things that you need to do throughout your day. So you might get that food coma like you've had after Thanksgiving simply by eating a really high fatty food. I know I'm guilty of this whenever I've got a great pizza that I want to eat. I just want to relax and sit in the couch for the rest of the day. So think about those kinds of things whenever you're choosing nutrition. Having a good balanced, a little bit of carbohydrate to get some rapid energy, a little bit of protein in there to get the sustained energy, getting some fiber and all of the other nutrients that you might need for your body to work. All of those are going to create a nice little baseline. The rest of your energy level are going to be based on the things that you do to get your own mind working. And that's going to be the kinds of things that we deal with whenever it comes to dealing with your own personal health and your own psychological well-being. Good luck.